Good afternoon, everyone, and welcome to the Bunker Hill Community College and Mass General Brigham COVID-19 Education Panel and Discussion. I am Pam Ettinger, the president at Bunker Hill. I understand that we have over 100 folks in the audience with us today, joining from inside the college and in the community, and also across some of our states. I hope this event will be informative for you. This event came about through the good offices of our past trustee and current foundation board director, Ms. Carmen Vega Barakowitz. Carmen is the director at MGB, and she has this wonderful title. She is the director of the Department of Speech, Language, and Swallowing Disorders and Reading Disability, but also a spiritual care and medical interpreters. I mentioned to Carmen our concern at the college for the level of vaccine hesitancy in our communities due to historical distrust of the medical research community, the lack of access, and in many cases, simply a lack of information in our home languages. That's when Carmen put us in touch with MGB and its Trusted Messenger program. And a bunch of conversations later, here we are. Through our panel and our conversation today, I hope you will hear important information from our experts, physicians and scientists in the field. And as you become knowledgeable, we hope that you too will serve as a trusted messenger to your community about the importance of vaccines in defeating COVID and returning to our work and our studies and restoring our vibrant economy in safety. So our facilitator today is Ms. Naomi Carlisle, Associate Vice President and Chief Equity and Compliance Officer here at Bunker Hill. So without further delay, Naomi, I'm passing the microphone to you.
Thank you, Dr. Ettinger, or Pam, as you like to be called. I want to thank everyone for being here today. All of our participants, this is an incredibly important topic. This pandemic has really railroaded all of our lives since it has begun. And we're finally at a point where vaccines are here, and we're hoping that there's hope for the future moving forward. And so many people have already taken the vaccine, and a lot of people are hesitant to take the vaccine. And honestly, I understand. So we found the need, and we're so happy that we have participants here today, and we have doctors here from MGB and MGH to help us understand more about what's happening with the pandemic and more information about the vaccines. We have quite a few questions already scheduled, but if you have additional questions you'd like to ask our experts, feel free to write into the chat. I do want to do brief introductions of our experts. We have Dr. Joseph Betancourt. He's a Senior Vice President of Equity and Community Health at MGH. We have Dr. Ernesto Gonzalez Martinez. He's a professor of dermatology at Harvard Medical School and dermatology at MGH. Dr. Priya Sarin Gupta, internal medicine specialist at the Charlestown Health Center and operations director at the Kraft Center COVID testing van. Dr. Alistair Martin, he's an ER physician at MGH and director of the Got Vax initiative. And Corey Ring, who's the senior administrative director of dermatology at MGH. We have tons of knowledge here today, so we really want to thank you all for being here with us. It is much appreciated for taking your time out, and we'd like to get started. So for the first question, it's going to be for Dr. Betancourt. Dr. Betancourt, could you please speak to COVID and the impact that it has had in our community?
Certainly, and first I want to thank you, Naomi, for inviting us. I want to thank Ann Fox for helping coordinate our MGB Trusted Messenger initiative. I want to thank Dr. Ettinger for the kind invitation. And I want to just begin by saying that at MGB, we stood up our equity and community health effort, which I've had a chance to lead back in March 16th of 2020. So we've been at this for a long time. This has been a long journey for us. And quite frankly, this was in anticipation of what history has told us time and time again, that natural and man-made disasters disproportionately impact vulnerable communities. And in preparation of that, we've done a lot in the midst of the first surge, including doing things like now delivering care kits. We've delivered over 500,000 care kits, about 4 million masks. We've done things in the clinical space, in the virtual space, in all spaces. And I'd say that we've done that because we care deeply. We've centered equity within our work. And everyone you're going to hear from today are friends and colleagues and people for whom this work is personal. And by that, I mean, this isn't an academic pursuit for us. This is our life's work. And so we come here with all due humility, with a lot of passion and commitment to make sure that everybody has the information that they need to, we hope, make the right decision and get the vaccine. And so what have we seen over the last year? We've seen, as predicted, that working on a foundation of structural racism, building on disparities that disproportionately impact communities of color. We have seen that communities of color have been hit hard. They were hit early, and they were hit here locally and across the country. Why? Those, the factors that lead to residential segregation, the factors that lead to disparities, noting that if you got COVID, you were going to do worse. Our communities being largely composed of essential workers, multi-generational housing, densely populated areas, all created a perfect storm for COVID, really just being destructive in our communities, emotionally, physically, financially, in all ways. And I think we've tried to do everything we could to mitigate that damage over time. But we're at a really exciting place here. And we're at a place now where we do have a path to getting back to normal. And it is the vaccine. And we know that among our community, again, we predicted, given the mistrust and a history of racism, segregation, medical experimentation, language barriers, immigration concerns, a long list, that our communities would be lacking confidence in getting the vaccine. But, this issue just isn't about lacking confidence. This true equity strategy is about placing vaccine in community, making it easy for people to get, and giving them information they need to make informed choices. And that's been our commitment. So, clearly this has been really tough in a lot of different ways for our communities here and around the country. And this is our path towards a better future. We're looking forward to, answering any questions people have around the vaccine. And again, my colleagues are involved in a lot of different areas related to this work. So it's on, and we look forward to the conversation.
Thank you, Dr. Betancourt. And you're right. For a lot of us, it's our first time ever living through something like this. It's scary. History shows us quite a few things. So this is why it's so important to have these discussions now. And speaking of which, Dr. Gonzalez, you've experienced pandemics in the past. Can you explain how you were impacted in the past and how this experience is similar? And why do you think the vaccine is important?
Naomi, can you hear me?
Yes, I can.
Thank you again for the invitation and introduction. I'll read my remarks in English, but then I'll at the end will make short remarks in Spanish for the Spanish-speaking population as well.
That's fine. Thank you.
Thanks to the administration of the Bunker Hill Community College, specifically Dr. Edinger, president of the college, as well as other officials of their institution, for their concern and invitation to this informal forum. COVID-19 pandemic infection is responsible for over 500,000 deaths among US citizens in a very short time. We all have endured a transformational behavior experience beyond the one produced by HIV/AIDS infection back in the 1980s. Its impact has been profound for its personal and collective human psyche, as well as for the effect on the economy. Epidemics in the United States have been described since the early stages of the American Revolution. Smallpox, a viral infection brought in by European settlers during the colonization stages, was devastating. Since then, many others followed, from bacterial to viral infections that eventually were controlled by intense, effective public health policies, and in many cases were controlled by vaccination. Most of the present audience may not realize that we all received vaccinations during childhood, during our approval with our parents' consent. Presently, we are all vaccinated for tetanus, polio, measles, and whooping cough, with boosters provided after several years to maintain adequate levels of protection. For us, the older population that still remember receiving smallpox vaccine with the fever, and malaise that followed, as well as the development of consequential smallpox scar on the arm, is a reminder of how severe this disease was in the past century. The practice was finally rescinded because the viral infection was eradicated globally, a tremendous success due to the diligence of receiving the pox vaccine and the eradication of the smallpox virus. Periodically, we learn of episodic emergence of viral infections, such as measles, and its health consequences due to the indiscretions of certain populations unwilling to follow the protective regulations and policies established, including some that are hesitant to be vaccinated for various reasons. Most of us receive the flu vaccine every year due to the appearance of mutations by the virus that requires that the vaccine is modified to conform to these mutations in order to be protective and to avoid the influenza epidemic during the past century. As the old statement of this panel, I am invited to describe briefly my existential experience with epidemics. The first one was my experience with tuberculosis, a bacterial infection highly contagious that I was exposed as a child grown in extreme poverty in Puerto Rico. My mother had already been exposed before I was born to the disease, living as a homeless with her mother and two siblings under a neighborhood house bordered by cardboards and no sanitary facilities. Eventually, both siblings succumbed to tuberculosis. After surviving this experience, my mother eventually married my father, who contracted the disease as an alcoholic and passed away when I was 5 years of age. We lived together with my brother in a small, humble house, all cramped in two small rooms with no running water and primitive sanitary facilities. My mother had to share the same bed with my father while me and my brother shared the other bed. Even at that early stage of my life, I still remember vividly the emaciation of my father with the constant characteristic dry cough that frequently bloody sputum that my mother had to collect and put in a basin so that we would not be exposed to this bacterial infection. Luckily, my mother never contracted the disease and she lived to be 90 years of age. Similarly, we were also spared of the disease, although we retained the immunologic reminder of a strong positive tuberculin test through the years. Since there was no tuberculosis vaccine at the time, we considered ourselves blessed or lucky that we survived. The inherent and important message of this personal existential experience is never to depend on luck. Be proactive to receive any protection offered for free by our authorities, especially when it's based on solid science, as the COVID-19 vaccine. You should realize that the development of this vaccine was a breakthrough, developed in record time or less than a year, compared to the usual 10 years of vaccine development. Furthermore, its impressive protection rate of more than 90% and the scientific ingenuity to develop a vaccine utilizing messenger RNA rather than a complete viral genome provides a more protective method of immunization. I exhort each one of you to go to the designated vaccination stations, expose your arm, and feel this small pinching pain to protect you as well as your surrounding community, especially your loved ones. Lucky strikes, as in my experience, don't happen frequently, and the blessing of being vaccinated is more predictable and will keep you and your significant others alive and in good health. The short Spanish version of this message for the Spanish-speaking audience. Les relato mi experiencia existencial con la exposición a tuberculosis durante mi niñez, donde mi madre, mi hermano y yo convivimos con familiares infectados por esa epidemia en Puerto Rico en los años del 1930 al 50. El hecho de que no sucumbimos a esta infección, la cual es altamente contagiosa, fue algo milagroso. A pesar de haber sido bendecidos, no debemos depender de milagros, pues no ocurren frecuentemente. Durante la presente pandemia, la ciencia nos ha beneficiado con una vacuna que es muy efectiva y produce reacciones adversas mínimas que son temporeras, comparados con la infección por COVID-19, la cual es altamente contagiosa y devastadora, con efectos que son severos y han producido la muerte de más de 500,000 de americanos. Como decimos los puertorriqueños, coño, despierta, boricua. Acepta el beneficio de la vacuna que te ofrecen gratis y basado en evidencia científica de ser efectiva y sin efectos adversos permanentes. Acepta la responsabilidad de ser buen ciudadano para protegerte a ti y a todos los que te rodean, especialmente familiares queridos. Te exhortamos que acudas a los centros de vacunación haciendo una cita y asistiendo puntualmente para recibir un pinchazo en tu brazo. No hay fiscalización de la migra, ni hay discriminación por ser hispanos o latinos. Gracias muchas. Thank you very much for your attention.
Thank you, Dr. Gonzalez. And thank you for, saying in Spanish. We have we have a very large Latinx population, and we appreciate that. Dr. Gonzalez was speaking a lot about the vaccines that we've taken as children and vaccines that had to come up very quickly in the past. My next question is for Dr. Martin. Now that we have the vaccine, it feels like the vaccine has been brought on at lightning speed. And many people are wondering, how did this happen so quickly? And is it safe? How do we know it's safe, Dr. Martin?
It's a great question. Thank you so much, Naomi, for having me. And first of all, thank you, Dr. Gonzalez, for sharing your powerful story, for being vulnerable with us and opening up a piece of you and your experience to us, to this audience. That was so powerful. Thank you to Dr. Ettinger for inviting us. Thank you to Dr. Betancourt and Ann Fox, who run the incredible Trusted Messenger program and really sort of quarterback, what is an incredible operation throughout, not just Mass General, but throughout the whole MGB system. To do exactly as Dr. Betancourt said, this is not an academic project. This is, we are compelled to serve, and this is service, So it's a really good question, Naomi, about the speed at which this vaccine came online. And look, I'll be totally transparent that I was one of the first folks that was offered the vaccine back in November at Mass General Hospital in the emergency department. And I also asked the same questions. How is it possible the vaccine came online this quickly? And so I started to do my own research. And here's what I learned. The first is, this is a once in a generation governmental response in such a way that we have never seen before monetarily. The government paid orders of magnitude higher amounts of funding than any private vaccine making company has ever done on their own. And so we had this really robust engagement from the government perspective to really fund this operation from the beginning. The second is, I started thinking, well, how's it possible we've created this whole new, vaccine technology? And it's actually not new, which is very interesting. We have used mRNA, studied mRNA vaccines in the past, Zika, rabies, even in some cases with influenza in the past. And so this wasn't something we had to start from a blank slate. we actually had this technology. We've been working on it for decades. And so really being able to tweak it and modify it and make it perfect didn't happen over the course of last year. It happened over the course of the last 20 years. And then the third is that this is an unprecedented, sort of Manhattan Project style coming together of the whole human race, really. I mean, this is not just the story of one country coming together to try and get this vaccine studied and get it to be effective and get it to be safe. This is the story of scientists all throughout the world who all had this one single mission with clarity: get a vaccine that is safe and effective. And that is what we did. And so for folks who are skeptical about the speed at which this came online, know that your concerns are certainly, we hear those, but there are very, very, very clear data points that argue for why this was done in a safe way and an effective way, and really in a miraculous way at the end of the day.
Thank you, Dr. Martin. My next question is for Corey Ring. Rolling out the vaccine has had to happen quickly, as Dr. Martin just explained. And can you explain what your role is and speak to what you saw in the vaccine clinics? Was there anxiety? Was there a sense of relief? Like, what was that experience? Or what is that experience?
Thank you, Naomi. Thank you for having me. It's an incredible honor to be here among my colleagues, physicians, advocates. It's just incredible to be here. So thank you for having me. Let me speak to my experience. I was tasked back in Thanksgiving to stand up the MGH vaccine clinic. And so around Thanksgiving is when we knew vaccines would be approved soon. And we knew that healthcare workers, particularly healthcare workers that care for COVID patients, would be among the first in the nation to receive it. So it was our job at MGH to pull together a vaccine clinic that was safe, both from the perspective of protecting each other from COVID, as well as administering vaccines safely, and to do it quickly for the sake of our healthcare workers. So we were up for the challenge. We gathered all the experts together, and we were able to do it in really record-breaking time. So everything from finding the site to developing the protocols to working with the state to make sure that we were delivering it safely, finding the staff, training the staff, and it was an incredible effort. So what we did in the MGH employee vaccine clinic, we were among the first in the state. We vaccinated over 50,000 people and transitioned that effort into the now ongoing patient vaccine clinics. And we saw and learned a lot through the experience. One of the big takeaways for me was just how emotional the decision to take the vaccine is, and the range of emotions that come with that, and that every emotion is normal. So I saw it all the way from people who are so excited to get the vaccine. They're refreshing on their phone every 5 minutes to try to get the appointment. They're elbowing their way. They're basically knocking over their grandmother to get the vaccine. They're so excited. And they're shouting through their mask how happy they are, crying when they receive the vaccine. Pure joy. But honestly, as often, I saw anxiety for every reason, to be in a clinic around a lot of people, anxiety to get a shot, any shot, not even COVID vaccine, just a shot. The vaccine itself, some of the things that Dr. Martin was talking about, just, it was developed so quickly. How can it be safe? We saw it all. And our job really was to meet people where they were at. It was not to convince people who had an appointment to get the vaccine today. If we could answer every question and then they decided to get the vaccine, of course we're thrilled. But if all we accomplished was to answer every question that they had and they felt heard, and then they could decide to make an appointment another day, I was also happy with that outcome, because it wasn't about pushing people. It was about being a resource to answer every question. We got a lot of questions. We were calling in the managers and directors to come help us out. And, in the end, my favorite emotion that I experienced was one of hope. There were so many people that at the end, they would look at you and say things like, thank you. Now I can see the rest of my life. And, you know, just things like that. We had hard days in that clinic, that is for sure, but I wouldn't trade it for the world, just to be a part of that hope.
That's great. Thank you so much, Corey. And I mean, I could just imagine that roller coaster of emotion from everybody coming in. I mean, like we said, you know, a lot of people have not experienced this before. Those who have experienced it before are probably also re-traumatized or petrified, like, oh, here we go again. And those of us who we just haven't seen this, you don't really know how to move forward. So we appreciate that. Next question is for Dr. Gupta. Dr. Gupta, you're in our communities every day doing mobile testing. Can you explain your work and speak to what you see in our surrounding communities? Why do you think testing is still important, even though now we have a vaccine?
Sure. Yeah, thank you for inviting us and for the introduction. So as background, so I am the operations director for the MGB Craft COVID testing van, which is part of the larger Mass General Brigham Trusted Messengers program. And the idea behind our work for the last almost 20 weeks has been to implement a community-facing initiative where we're bringing COVID testing and care and meeting people where they are at in the communities, and especially trying to reach those very vulnerable individuals in our communities who, you know, have some mistrust for the larger institutions and don't necessarily want to access their care and their COVID testing in brick and mortar infrastructure. And so we have been conducting testing in some of the hardest hit communities in our area, including Chelsea, Revere, Everett, Lynn, and Charlestown. And our approach has been to really respond to the needs of different communities. So we've partnered a lot with the community organizations in each of these communities to drive where we should be taking our mobile unit to. For instance, this past week, there was a small outbreak of positive tests in a school, in an elementary school in Revere, through pool testing. And so, you know, we got a message from their director of public health asking us if we could, you know, bring our van to a location which would allow individuals that have contact with children at that school to easily get tested. And so that's what we did. So early on when we launched the van, we were, I guess our purpose has evolved over time as the testing guidelines have changed and as vaccinations have come into the picture. So early on, there were needs around testing to keep community members and family members safe, especially in those communities that were at higher risk for various reasons, you know, people living in multi-generational families, people who are essential workers, things like that. Now, as the landscape has changed a little bit, we're really trying to do very directed testing where the need is at. So, you know, for instance, you know, where does the testing need still exist? So hopefully we're getting to this now in the next few weeks, but right now, most children are not vaccinated. So there are some testing needs around the pediatric population and individuals who regularly interact with that population. Similarly, you know, as vaccine efforts, they're not, it's not an equal percentage of people that are vaccinated across the country or across the communities. And then certain other populations remain at risk. So, you know, on occasion, we'll have individuals access testing who are patients who have other medical problems that make them especially susceptible to negative outcomes from COVID, and their family members who might, you know, we have this patient who's accessing cancer care and is frequenting the hospital. And so their family members often come to our van to get tested. We also have been using wastewater surveillance data to guide some of our testing. So really, wherever it seems like we're going to get a small uptick in infections, using the mobile strategy, but with really a larger purpose, to be there for the community, to send this message that, you know, we're all on the same team here, and that that Mass General Brigham is in these communities as part of their village, and trying to get all of us out of what has just been such a hard year for everybody.
Thank you, Dr. Gupta. We have like quite a few more questions. I'm going to open it up to the whole panel. And if people have any questions, they can put it in the chat. one of the first questions we have, and anyone can answer this, is, does the vaccine contain a live virus?
I'm happy to take that. It does not. It does not contain a live virus. I mean, I think, what we know is getting the vaccine will not give you COVID, and quite the opposite. Getting the vaccine, with great certainty will prevent you from getting COVID and certainly prevent you from getting sick and dying, which is the most important part of this whole equation. So, I think the good news here for people who still want more information, for people who are still hesitant or lack confidence, is that the early surveying showed that among us, I'm originally from Puerto Rico, our Black and brown communities, there was hesitancy, but there wasn't kind of a sense of, I'm not going to get it, right? So I want to assure that this isn't about being anti-vaxxer. Now, that's not what we heard. What we heard more was wait and see, not me first. I'm going to kind of wait and play this out. So what we need to understand now is, if now is your time, you can you can rest assured that a lot of people have gotten the vaccine. The data has been really, really good. Side effects are really low. Long-term consequences, nil. We heard about Johnson & Johnson. That's 6 cases in like 8 million, among 8 million people. So the numbers are really, really small of anything that's negative. So the good news is that if you were willing to wait for a while, you need to know now that 35% of the U.S. population has now been vaccinated. Almost 4 million people here in Massachusetts alone. We've done well. We've tracked it. And so hopefully we could, kind of take that fear out of the mix.
Okay. So, you just mentioned the Johnson & Johnson, Dr. Betancourt, and that's the next question, open to anyone. Johnson & Johnson vaccine was pulled from distribution. And that was after how many people already taken it. And now suddenly the J&J vaccine is back. How can we have confidence that this vaccine is not only efficient, but safe to take?
I can jump in there, just building off of what Dr. Betancourt said, which I think is just so important to remember his words. I want to highlight one specific fact. There were only 6 cases of blood clots that came out of that initial reason to pause. And I'm gonna argue here that you actually should have more confidence in this whole process because of that. Out of 6.8 million vaccines that were given, we had 6 folks who got blood clots. Let's put that into context. The risk of getting on a plane, going from San Francisco to Boston and getting a blood clot is twice as high as the risk of getting a blood clot if you have a Johnson & Johnson vaccine. And folks fly with no issues, right? Folks going down to Tulum, Mexico, flying down to Puerto Rico, flying all across the country, not really concerned about getting blood clots. And what I'm here to tell you is that if you're comfortable flying, you should be comfortable getting a Johnson & Johnson vaccine because the risk of getting a clot is half as likely. Number one. Number two, this is a great example of the system actually doing the work it needs to do, which is to identify issues and when possible, pause, do a retrospective analysis and figure out what the issues are. And so while the pause, quite frankly, was certainly disruptive, let's not beat around the bush. With the work that we're doing with GOT Vax, Get Out the Vaccine, we've been out in the communities helping folks get access to the vaccine in low-income communities throughout the city of Boston. And it has been challenging with the Johnson & Johnson vaccine. But what we say is, if you look at the data, this is an incredibly safe and incredibly effective vaccine, and it demonstrates a system that's working properly to keep us all safe.
Thank you, Dr. Martin. What we're seeing is that in terms of, some data shows that in terms of contracting the vaccine and actually, dying, it's hitting more the older population. And so what would you say to a younger person who basically feels like they're in the prime of their life, they're healthy, and, even if they got COVID, they'd be okay? What advice would you give to the younger demographic?
I'm going to say one quick thing and just turn it over to others, but I'll just quickly say this. Here in Boston, if you're a sports fan, right, there have been a couple of cases where athletes, young, I mean, physically fit. I mean, these are people, who are just in the best shape of their lives, have gotten COVID and have talked about the long-term impacts of COVID. How, Jason Tatum had trouble catching his breath. Evan Fournier, who plays for the Celtics, spent months not being able to see, the lights blinding you, right? So what we want people to understand is, because you're young, yeah, you might get COVID, you might get a little COVID. We do not know the long-term impact yet. We're still learning. And if current history is an example, we have young people who are in top physical shape who are talking about these long-term impacts. They can put their careers, just, athletics, just as an example, in jeopardy. So this, COVID's like Russian roulette. You don't know, number one, and being physically fit, isn't going to protect you. And the downside of anything related to vaccine is so much smaller than the downside of getting COVID, because you just can't predict what's going to happen. So, it's not only a way to protect ourselves, a way for us to protect our families, protect our communities, and it's the right thing to do. My kids, my daughter who's 18 has been vaccinated. My son's going to get vaccinated next. I wouldn't recommend anything for my kids that I would recommend, for anybody else. So I'm happy to, I'd love to hear from my colleagues as well.
Yeah, I agree, and I just often add, when I'm speaking to young people on the van who are asking about whether they need to get the vaccine, is just to remind them that if we've learned anything from this pandemic, it's that we don't exist in isolation, and that we have these families and communities that are so important to us and our welfare. So whether or not they specifically feel that they're at risk, it's to keep grandma safe or grandpa safe and other loved ones and family members.
Thank you. Thank you both. We have quite a few more questions, so I'm going to move on. There are many people who have contracted COVID over the past year and have, or may think they have, antibodies that will protect them from COVID, and that the vaccine isn't necessary. Is it still important to get the vaccine if you've already had COVID?
I'm happy to. Oh, go ahead.
I mean, I'm not a physician, so I don't know that I'm the authority to speak on this, but I can tell you through the vaccine clinic, I've met many, many, many people who had COVID and had an appointment to get their vaccine and couldn't because they got COVID again. So just because you get COVID doesn't mean that you're protected from COVID forever. We don't know how long antibodies last. I had some really, really sad people that they couldn't get the vaccine because of it.
Thank you, Corey. What about advice for women who are pregnant or nursing?
So so far, there's nothing to indicate that it would be any different recommendation for women who are pregnant or nursing, and it's even more important that they get the vaccine and stay safe during this pandemic.
Okay. The immigration concern. There are a lot of people, they feel that, I am undocumented. Can I even show up to get this? Will I have to bring identification or proof of insurance? Do we have any advice for people who may be undocumented or maybe not have any health insurance?
I understand something in the chat. Priya's been involved in vaccination. Alice has been involved in vaccination. We've been involved in vaccination. It's free, and we don't ask for any proof of citizenship. And if you don't have ID, we ask for name and date of birth. I mean, we try to make it as easy as possible. So any rumors around kind of needing to be a citizen, needing to pay, are unfounded. And they could both speak to that because they've both been involved in this, as has Corey. So clearly we want everyone to get vaccinated, and this issue should not be a concern, nor should the ability to pay be a concern.
Thank you, Dr. Betancourt. We have seen a disproportionate impact on different races, different demographics due to the pandemic. Does COVID affect people differently depending on your race, or does the vaccine help or hurt people depending on their race? This is one of the questions that has come up.
And I can start us off. The reason why we see such wide disparities with regard to COVID impact by race has nothing to do with biology. There's nothing inherent in the DNA of a Black person or a Latinx person that makes them more susceptible to getting bad COVID. It's principally related to what kinds of jobs we end up doing. Folks who look like me, look like Dr. Betancourt, Dr. Gonzalez in this country. Many of us are working on the front lines. Many of you are working on the front lines, bagging groceries, driving the bus, and doing these types of jobs that don't allow us to work from home. We're still out there in the community, still taking care of folks. And so unfortunately, that means that we're more exposed. Secondly, it comes down to where we live. I had a patient early on in the pandemic who I think it was may have been May or June of 2020. And I'll never forget this. I remember, diagnosing, I said, look, I think you have COVID. She was a young mother, had 2 kids and lived in an apartment in Dorchester with her aunt and her elderly mother. And I said, you're going to have to take some time and self-isolate, and really, don't be near other folks for the next 14 days. She said, doctor, how am I supposed to do that? I live with my 2 kids and my elderly mother and my aunt. How can I self-isolate? And so most likely she might have spread it to other folks. And so that's another way that we end up contracting and suffering from this disease more than others.
Naomi,
you.
Naomi, I want to break in here for a second to ask everyone to look at chat. That the college will have its first on-site vaccination pop-up on June 2nd, and then again on the 23rd, since there are 2 shots, between 3 and 7 to accommodate students, especially those who work. And if this particular vaccination clinic or pop-up really fills and it works, and there will be additional ones scheduled. This is in partnership with the City of Boston, and we're going to continue to work with other partners in order to get further pop-ups in different sites. So that's for folks to take a note of. We'll keep sending out notices, and this is open to the public as well as our students. We just have to make sure enough people sign up and show up, right? So that there's no wasted vaccine or every piece of vaccine gets used. So thank you for allowing me to break in there.
Thank you. One of the questions from the chat, we have 2 questions actually about children receiving the vaccine. One says, I plan to let my 14-year-old child get the vaccine. Are their side effects the same as adult side effects? And my question also would be, there was a delay in allowing children to get the vaccine. If someone can address why was that and why is it safe now?
Yeah, so maybe I'll jump in. So we just got authorized now to do 12 and over, right? So let me start with the second question first. The reason why that authorization took a while is because we first started all the clinical trials in adults. One vaccine, 16 and over for Pfizer, 18 and over for Moderna, 16 and over. And I get 16 and over for Johnson & Johnson as well. But then the next phase is to test 12 to 16. It's arbitrary, but that's the next kind of group that you do testing in. Now it's approved 12 to 16. Now they're going to go like 6 to 12, and then they'll go 2 to 6, right? So it's more of a phasing. It's not that they delayed it. It's just as you do these clinical trials, you start to kind of go younger and get that information. So that's one. As it relates to the side effects, I wouldn't anticipate that the side effects would be any different at all. Certainly the common things that you hear are obviously some pain in the arm. You might feel like you got some cold symptoms, little body aches. I had them myself, but I'll tell you, a couple hours of some mild side effects was an easy trade-off for protecting myself from getting COVID, right? So there's no side effects that people can't overcome. And with kids, I would say that even when they've gotten COVID, their symptoms have been way less. I don't know, maybe Alistair or Priya or others know on the line, if there's different side effect profile for younger kids. I wouldn't imagine so.
So another question is, a lot of people are concerned about getting the second shot. some people receive the first shot, that they're hearing more that when you get the second shot, that's the one, that's the killer, you know? So what is it about the second shot? That's the first part of the question. And also, sorry, I keep adding my own questions to this, so does the COVID vaccine work that once you have it, you're good for life? Or are there going to be additional vaccination requirements in the future?
Well, I guess, and maybe one of the other panelists might know more about this, but my understanding is that, we're still learning exactly how long the immunity with the vaccine will last. And I think a lot of some early studies are showing that there might be a booster involved. And my understanding about the symptoms with the second vaccine, I mean, I think everybody's body is different. And, when I talk to patients in my primary care clinic, some people had more symptoms with the first shot, some had more with the second, some didn't have any symptoms at all. But one possible reason for some individuals that get the symptoms with the second shot just might be that, it's just part of like sort of the immune reaction as you've had the first shot and then you're getting the second shot. But I think to some extent, we're also learning a lot about this because this is a little bit of a new condition that we're vaccinating against.
And I'll jump in there after Dr. Gupta. I made a mistake, y'all. The first shot that I got, I had exactly the same symptoms Dr. Betancourt described. A little bit of, arm pain, some fatigue, and so I was dreading the second shot because I'd heard that the second shot was going to be where things were going to get real bad. So I mistakenly agreed to go snowboarding, and it happened to fall on the exact day after I was going to get my second shot. I didn't look at my calendar, and I sort of went back and forth. Should I cancel this snowboarding trip? I'm going to be awful that second shot after that second shot. And I got the second shot, and surprisingly, I had no symptoms that night. I woke up the next morning, felt absolutely normal, and had probably the best day of snowboarding in my life. So just to piggyback on what Dr. Gupta is saying, that it's random. It's not 100% guaranteed that your second shot is going to make you feel awful.
Thank you.
And Naomi, I just want to say, the only thing killer is COVID here, right? So, that's the end of that. I mean, the second day, second shot, like you said, at worst you're going to be a little banged up. That's like the worst thing. And so this is two totally different things here. So I just wanted to add that.
Thank you. Yeah.
Ernesto.
Hi.
A personal anecdote, just for the people who has concerns about the second shot. I received my second shot about a month after the Moderna one. And that night I developed chills while I was sleeping. And so I took my temperature, which is completely normal. And I slept very cold the whole night. In the morning, I realized that my heat was off. So it was not really produced by the vaccine. It was produced by a technical error in my house with the electricity and the heat. So try not to blame things because you're anticipating that it's going to happen, because other things can explain that phenomenon. But I finally realized that all what I felt was induced by the fact that there was an electrical issue in my house, not because I was sick. My wife had the vaccine, the second vaccine, the same Moderna, and she had no reactions to it. And most of the people that I have talked to, they feel very well, and only a few have seen some minor symptoms, which are, again, very temporary.
Thank you, Dr. Gonzalez. Dr. Gonzalez is telling us, get the second shot and check our thermostat. Got it. Another question that came into a private chat. There's information on blood types and how some types had shown less severe reactions or effects to the virus. Is this true? And if so, how, if any, does that affect the vaccine? That's the question. Is there any variation with blood types and the effect that we're aware of?
I'll just say, there was stuff about this early on about blood type and severity of getting COVID. And I don't think any of that, came to fruition, meaning I don't think any of that was proven out around blood type related to how severe your COVID reaction is, or even to how you react to the vaccine. I don't know if Alistair, Priya, or Ernesto, or Corey have heard anything different, but, there's other things that we're studying now to see if there were certain aspects, what were the predictors of getting sicker with COVID, but that's about it. I don't think the blood type thing is accurate at all.
Okay. Next question. Is it true that if we develop symptoms in reaction to the second shot, that it's generally a sign of a robust immune system?
I can take that one. Yeah, that's a feature and not a bug of your immune system. If you get that, those aches, those chills, that means that it's working. Yeah, the immune system is coming online and beginning to do what it needs to do to begin to protect you against COVID.
Thank you. Our next question, sorry, Masha. Our next question is, we have questions about fertility. Some people are afraid to get their young daughters vaccinated because of fear that it may impact their fertility when they become of age. Do we have any data on that or any advice?
My understanding is what all the data has shown is it has nothing to do with fertility. It's even though it's called an mRNA vaccine, that doesn't mean that it affects an individual's RNA or DNA in any way. So I think that there are a lot of misconceptions, and on our community vans, that is a subset of the population that we're seeing that is having some more hesitancy around getting the vaccine. But I think we need to help get that messaging across that it is safe to get.
Anyway, I got to say, I never understood where that came from, that one, because you have the immune system over here and the reproductive system over here, and like I can't even see how people would how that kind of a theory emerged, to be honest with you. And so there's really not, just to second what Priya said, I mean, there's nothing there. And it's been a big concern, though. We've seen on Facebook, we've heard people talk about it. And so I just want to be clear, these are two different systems of the body working very, very differently.
Yeah, that's why these conversations are important. Sometimes, we follow some advice, and then 10 years later, you're watching TV and there's a commercial. If you ever taken this, you have a claim. And so it makes people nervous. And this is why education is important and why we're hosting this panel, because we want to hear from the experts, not from a commercial or people who think that they may know. We want to know the truth, and so we can make informed decisions. Here's another question, and I think this will be the last question, second to last. How will my life be different after I am fully vaccinated? Can I visit those who are not vaccinated? And I'll also add that I believe the CDC or someone said that we don't have to wear masks once we're fully vaccinated. Should we follow that?
Maybe I'll take a first pass and then open up for my colleagues. So look, what we know is this: you get vaccinated, you certainly decrease, your chance of contracting COVID. Now you got to remember, 95% effective means that if 100 people get the vaccine, there's 5 people who could still end up COVID positive, right? That's just the numbers, and that's great numbers, but that's still, that's still pretty good. Among those 5 people, still the likelihood that they're going to get sick or end up in the hospital or die is like nothing. So that's great as well. We're learning about, can you transmit COVID if you got the vaccine? Evidence is showing that, not impossible, but pretty low likelihood. Our guidance is just to follow what the CDC is saying right now. The state is saying we can take our masks off if we're not close around people on the outside. There are certain guidelines around mask usage as it relates to being in inside spaces. There might be some new guidance this week about indoor spaces and vaccinated individuals. So, this changes, Naomi, to be honest, day to day. And I think we need to follow the science, but I would always err on the side of being cautious. We're almost there. We're getting there. And there will be a time where we'll be able to ring the all clear bell and say, okay, we're good. But up until then, you know, it's much better to be careful than to not. And so that's what we know as of now. You know, being in a group indoors with people who are vaccinated, you know, is certainly safe. A small group, I think that's safe. You know, so CDC guidelines are changing every day.
That's great. Thank you. And last question, how do we get the vaccine? You know, what resources do you have available? We'd love to hear that briefly before everyone has to log off.
I'll start and just say that, you know, the good news is that there's more supply than there's ever been, and there's even more supply than demand. And there's a lot of different efforts. So cities and towns, go to your city and town website. You know, your healthcare providers or healthcare systems. We at Mass General Brigham have, you know, different collaborations with community-based organizations. We're going mobile. We have, you know, a bunch of different sites. Alistair's got great work going on where he's bringing, you know, him and his group are bringing the vaccine to people at their doorstep, right? So, you know, the good thing that I feel is that we're no longer in a place where, and we need to do better, but we're no longer in a place where we are like, man, there's not enough vaccine in the communities that have been hard hit. You know, if you just look around, there's a lot of opportunities. I'll have Alistair and Priya talk about, you know, some of the efforts that they're engaged in. But I mean, we're out there now, and we really have vaccine available.
No, that is helpful. And Alistair, Dr. Martin just wrote into the chat, so everyone has the link there. So thank you for that. We want to be respectful for everyone's time. So we want to thank you all for joining us today. This has been incredible. We are going to share it out and wide, and we really appreciate you. I don't know, President Ettinger, do you want to say any final words before we wrap up?
Just thank you. Y'all have been terrific, and we will try very hard to pass the word on and learn to be trusted messengers. And let's hope that we get through this thing with everybody safe. Thank you so much for your service to our community. This is terrific. And thank you, Naomi.
Thank you all.
Thank you all.
Thank you. It's an incredible hour. And thanks. Continue to go saving lives. We'll be here if you need us.
Thank you. All right.
Thank you, everyone.
Send reinforcements.
Yes.